Health Diagnostics' mission is essentially to ensure that the NHS health checks that are now being delivered throughout the country get to the most vulnerable groups. And essentially you can do that by having a completely portable unit so that people can go out into the community to actually deliver effectively to those people that wouldn't necessarily go into a GP practice.
Our model is very much about promoting lifestyle change, behaviour change. So we will focus on things like increasing physical activity, stopping smoking, reducing alcohol consumption, managing weight better, and it's about giving people choice. Our model, again, is about empowerment.
It's really important that we can get the health check into a single session. It's about 50% of people don't turn up for a second visit. So if you go to a GP practice and you have to have a venous sample, that's when you have to have a sample taken by what's called a phlebotomist. You have the sample taken from your arm. That goes off to a pathology lab and you have to wait a week for the results. So therefore you can't have all the results and what's called the motivational interviewing session where you can explain the results all at the same time.
So having a conversation, helping an individual understand what their risky behaviours may be in terms of the prevalence of cardiovascular disease. So communicating their risk and then providing them with the relevant advice and support in terms of lifestyle opportunities and signposting them to local services where they can access those opportunities. So it's very much about care closer to home and doorstep provision and providing choice.
The key achievements for us so far is that we have managed to screen over 65,000 people, so that's actually people who've had a check rather than just those that have been invited. So when we started the programme, the eligible population was just over 130,000, and to date we've actually screened over 65,000, and over 20,000 of those have been found to be high risk.
Civil servants who are extremely interested, I can assure you, in what's going on with health checks. And they tell us, that the Secretary of State is also following very closely what's happening, and they want to know why there aren't more statin prescriptions and so on. I thought I'd just tell you a little bit about the evaluation. So this is funded by the Department of Health Policy Research Programme, which is one chunk of research funding. This is a paper that's been accepted for the Journal of Public Health and hasn't been published yet. But what we are seeing is, as you see, greater uptake, well, put it this way, lower uptake in the least deprived areas, or the converse of which, greater uptake in more deprived areas. So that is very encouraging.
In addition to funding and evaluation of the NHS Health Check programme, the Department of Health have established a behaviour change team to help local authorities boost uptake and impact of the checks. Julie Everson outlined some of their principles for attracting people for a health check and encouraging lifestyle change.
You need to be looking for simple messages. You've got to look at convenient times and locations. And often GP practice, I find it very difficult to make an appointment at a GP in work time. So, and I'm not alone, but location and time and actually getting out to the individuals. Looking at reminders work really well. So if they received a reminder that they had a health check, then that actually boosted the numbers that came through. Looking at positively framed messages as opposed to, I think if you noticed outside on the board, there was one, are you a heart attack waiting to happen? That was in South of Tyne, where maybe that message worked there. If you can show pictures, people can take in the information in a much clearer way. So with the software that we've actually developed, we've used a lot of visuals to help support an operator going through the process so that they can point out to them, this is your risk. And again, we use slight betting mentality when we come to the risk score, where we say there's a 1 in 3 chance or there's a 1 in 8 chance, because when you use visuals like that, people tend to understand it a little bit better. Used extensively with our clients here is we do the what if scenario. So we show them where they sit as far as their risk is concerned, and then we show them where they would be if they change their habits, and they do it all in a single session. And from that you can see that you're going from 22, and if you look just below it with some minor changes, we can be down to below the risk level.
You all talked about motivational interviewing, motivational techniques. I think you can teach people techniques, but not everyone's able to do it. And have your team got Because I'd hazard a guess there's a difference between what's provided in the GP practices and the skills of the staff there and your outreach team as well. And I was just wondering if you could elaborate a bit more on what you think might need to happen around that particular thing, what you would recommend around that.
We've developed a learning needs assessment framework which will ask that very same question. What do the teams believe that their workforce learning development needs are? So, for example, brief intervention, motivational interviewing, obviously health diagnostics is the core accredited training, but what do they need other than that training? So perhaps some specific training around making every contact count.
We train with motivational interviewing. We started that with Jackie's team. So we train them on those skills. We provide them with the top tips cards because, again, it's one of those things you can't think of how to reduce your smoking, or give them some quite easy things to sort of engage with. But it's all about this non-judgmental approach that we're trying to get them to understand.
The requirement to make every contact count is a pressing one if the programme is to make a positive impact on people's lifestyles. Health Diagnostics provide training and consultation materials, so providers can offer bite-sized practical lifestyle advice to individuals who've had a check. Providers are also offered motivational interviewing instruction and guidance. Not only is it crucial to make every contact count in this regard, but ensuring that data makes its way onto the patient record is also essential if health checks are to count towards local authority targets. Andy Cowper raised this issue at the forum, and the panel outlined how they've resolved these challenges by developing an integrated solution.
I'd just like to take a quick show of hands, because I know that many of you here today are very involved with the implementation of health checks in your various capacities. Among those of you who are, how many of you think that you can conduct a health check out in the community and immediately transfer that data to any GP clinical system that there is, so that it automatically will populate the individual patient record without any manual interference at the GP surgery, other than the GP just clicking accept? How many of you think you can do that?
It's half elevated.
Okay, that's kind of 1.5.
If we're not getting it back into the GP system, it ain't going to be counted. So the fact is, it's got to be getting in there whatever way, and it's got to be cost effective and without error. So all those things are really important.
When I was looking at the information standard, I was thinking, how are they going to get the data from these alternative providers? Now I know.
I can't underestimate the importance of investing in good primary care informatics and also in IT solutions to support the delivery of the programme. So we've been very lucky in that we've had dedicated informatics support, and we've also been working with Health Diagnostics.
The NHS Health Check data is really key, that it actually gets into the GP practice systems. And it's been a little bit like the holy grail for us to can we actually get that data into the GP system. So what we did was we worked with an organisation who specialise in what's called DTS clients, DTS messaging. That's the way that all pathology information currently goes from secondary care from hospitals directly into the GP systems. So using that protocol, which is used throughout the country, we can now send messages over N3 as a DTS message that then goes and sits on the GP practice system. Yes, they have to accept it. It doesn't automatically go into the patient record, but they have to accept it, match it with the patient in their practice, and that information will then go into the patient's record. So it's about 3 clicks.
And what do you think of today's event?
It's very good. I looked for opportunities to discuss issues of concern to me about the programme locally and nationally. And I had that opportunity. I think people shared those issues and concerns that I have about the programme.
I think one thing that will stick in my mind is that we need quality data that we can prove the effectiveness of the health checks.
I thought it was really well put together. I liked the fact that it was, succinct. The speakers were excellent. The presentations were good range, and I got quite a lot out of it because I'm quite new to health checks, and so there's a big learning curve for me. So today was a really useful journey to come into London. Yep.
That's great. If there's one sort of message, or maybe 2 that you'll take home and remember from today, what would those be?
I think as a commissioner, we have very sort of big key decisions to make around investing in the IT infrastructure. That's my overriding impression of today, and I'm going to be going away and talking to colleagues and stakeholders about how I can make that happen in my local area.